பசிடர கற்பவை கற்றபின் நிற்க அதற்கு தக, which means let a man learn thoroughly whatever he or she wants and let his conduct be worthy of their learning. On behalf of this Computer Science Department, University of Madras, it's a moment of great privilege for me to extend a heartily welcome all of you for RUSA 2.0 Myobacteria's Team 2, the third day program scheduled on respiratory motion prediction of lung tumor using artificial intelligence. No person were ever honored for what he received. Honored has been rewarded for what he gave. So it's our pleasure and a honor in welcoming our Honorable Vice Chancellor of University of Madras, Professor Dr. S. Gauri sir. It's an important to be a person of honor than be a person with wealth. As an idol to this, I welcome the dynamic researcher, Professor Dr. N. Madhivanan sir, overall coordinator of RUSA 2.0 Research, Innovation, and Quality Improvement. I welcome the backbone of the project and supporters of principal investigators, Dr. P.L. Chitra Madam, Dr. M. Swarna Madam, and Dr. B. Lavanya Madam. Never stop learning because life never stops teaching. It's my immense pleasure in welcoming our eminent speaker of the day, Dr. J. Chandra Madam, Associate Professor, Department of Computer Science, Christ University, Bangalore, doing research in data analysis focused on predictive analytics in BI and healthcare, currently working with medical imaging of data analysis. Welcome, ma'am. We cordially welcome professors of our University of Madras, professors from other universities all over the country, and affiliated college professors for this workshop. Also, a friendly welcome to young research scholars, PhD students, and participants to update the knowledge on recent trends in respiratory motion prediction on lung tumor using artificial intelligence. Welcome all, and over to P.L. Chitra Madam to say some words.
Thank you, Akshaya. Happy evening. I am very much delighted to welcome you all once again for this third day of 2 weeks workshop on analytical tools for image processing. It gives me an immense pleasure to welcome our eminent professor, Dr. J. Chandra, Associate Professor, Department of Computer Science, Christ University, Bangalore. He is going to deliver a talk on respiratory motion prediction of lung tumor using artificial intelligence. He is actively working on image processing, machine learning, artificial intelligence, and deep learning. He has got a very good reputed publications and books publications as a credit. Today, we have an eminent resource person. First day, we have started with cancer imaging and therapy using radioisotopes by Dr. S. Santosh, MD, nuclear medicine. He has poured the knowledge of how doctors are giving treatment based on different modalities of the images and how the processing will be carried out, what are the tools it has been used, how nuclear medicine is helpful for our workshop. The day 2 has been enlightened by Dr. D. Peter Augustine, Computer Science, School of Science, Bangalore, Central Campus, Christ University. He has been focused on what is cancer, comprehensive care, right from prevention, diagnosis, treatment using nuclear medicine, right from radiotherapy, medical imaging, surgery, pathology, clinical laboratory. He has also mentioned current role of imaging in cancer care, how nanomedicine applications for cancer would be helpful, and he has thrown light on interdisciplinary research, cutting edges of the various disciplines, biology, chemistry, engineering, physics, and medicine. He described about nanoparticles and its unique properties, how oncology is going on, and he spelled out tools like HPCC and Hadoop tools. So the third day, we are going to have respiratory motion prediction of lung tumor using artificial intelligence by our eminent resource person, Dr. J. Chandra of the day. Welcome, ma'am. And I take this opportunity to thank you for having readily accepted our invitation and throw light to our participants for this day. Now I request Akshaya to introduce the speaker.
Yes, ma'am. Thank you for your speech, ma'am. And I'm glad to introduce Dr. G. Chandra, Madam, Associate Professor, Department of Computer Science, Christ University, Bangalore. And she's doing image processing and also some more artificial intelligence. Some of her articles and journals are the role of machine learning in cancer genomic analysis for precision medicines, experimental evaluation in image segmentations of heart images, stress classification of medical practitioners using machine learning techniques are some of her journals. And some of her books publishers are Lecture Notes in Networks and Systems, 2020 International Conference on Emerging Trends in Information Technology and Engineering, Intelligent Data Analysis for Biomedical Application, Lecture Notes in Computational Vision and Biomechanisms. Some of her guide topics are like PhD and MPhil topics are SVM Ensemble for Insurance Data Analysis, Semantic Mapping for Big Data Visualization, anomalized detection in Down syndrome using mission intelligence. Some of awards and achievements are SAP certifications, ISTE membership, IAENG membership, ACM professional membership, appointment as a BOS member for autonomous member. Thank you, ma'am. Thank you for coming here. And please share your words, ma'am.
Thank you, Akshaya madam. Thank you, Dr. P.L. Chitra ma'am, for the opportunity. I thank Madras University for giving me an opportunity to deliver my experience with this area, especially with respect to respiratory motion predictions and of lung tumor using artificial intelligence. This is an ongoing research project of my scholar Kaushik Pratham Das. So we will be actually just briefing about. I requested him also to join. Unfortunately, I think he could not join today because he was giving parallelly one funded project presentation for the same work. And I should actually appreciate him. There are several awards we also received for this because in Christ University, we have a collaboration with the Korean University. There is a concept called PRISM. Every year we conduct. So this one of the concept of our lung tumor cancer is actually recognized as the second prize, and he also got the prize money around 50,000 rupees, and he published Wiley publications and then CRC publication, and recently we actually presented to international conference, and then post conference is actually based on the journal publication. So with that I will quickly share my screen. I should give a special thanks to Madam Chitra for giving an opportunity for me to share the experience. So is that my screen is visible, ma'am?
Yes, yes.
Yes, ma'am.
Yeah.
Very much visible.
So thank you all for the nice introduction and the kind words. I have to actually thank, because being a person from Tamil Nadu working in Karnataka, I always pleasure to meet the people from own region, because of the pandemic, we could not come and see the border issue. All those things are there. But then the nativity feeling, I feel that whenever I talk to people. So especially thanks to the management and the department and all the organizer. And a brief note, because I did my PhD in Hindustan University, Chennai, with respect to the business intelligence, especially with respect to the stock market prediction. But my inner satisfaction was actually not that much happy, because I wanted to do something that is with respect to the medical related things. So first, my scholar actually, we worked with sudden cardiac arrest. So we developed a model that was, and and she also actually presented various awards. She went into Oxford University, UK, and she presented her work, and it was well appreciated, and she got the best prize award. And she has actually right now got the appointment as the postdoctoral fellow in one medical university, US. And the second, my scholar did the document classification. This work is actually, see, I am working into emotional intelligence, neurological disorder, stress analysis with respect to EEG. See, when madam asked, I thought I should actually brief about our work, even though it is, the work is not completed. We have actually done 60 to 70%, but still it is actually a open challenges are there. I should thanks to the team, the workshop team for giving me an opportunity. So let me start my session with the few concepts. See, today agenda for the session is there are research problem, some general assumptions are there, and what is the need of this particular research work and our objective of this work, and we'll be introducing about little bit about the domain, and then the few literatures wherever we did with respect to pre-processing as well as with respect to the segmentation, then with respect to fusioning, because ours is a hybrid model what we used. As you all know that in medical field, the recent scenario is not only using only one particular image, they try to actually mix MRI, fMRI, MRI, CT to get the accurate diagnosis. But there is no common model in which where people can use like a PET CT or kind of a PET and MRI, MRI and PET. All these things are actually it is not there. So that was the motivation for us to think about in this particular area in which where we thought we will actually do a small work in this. So the main objective is we will be developing a model. That model will actually try to identify the respiratory motion of the lung tumor to incorporate the irregular variations and breathing patterns of the patients affected by the lung tumor to plan the accurate radiotherapy treatment delivery. That's what our objective. The general assumptions and all, one second. Just let me close this. Yeah, the general assumptions, ours is actually it is confined to the lung region, and we are not actually planning to go for any other things restricted to, especially with respect to the PET and CT images. The need of the research work, as I told briefly, but I will be, giving in detailed idea about the tumor motion due to the respiration can change rapidly according to the type or the breathing of the patient as well as the cardiac motion, because this lungs and the, the heart is two different neighbors. All these are actually a respiratory movement. It will give a lot of disturbance with respect to the scanning time. Okay, so this irregular breathing pattern is one of the major problem with respect to the respiratory movement. A significant amount of artifact will be introduced at the time of actually, capturing those kind of an images, especially with respect to the lung tumor motion is not taken into account. So these artifacts can decrease the quality of the image generated from the diagnosis, and it will also affect the target value during the treatment planning. So our idea is to give a recommendation system for the treatment planning. So till date, there is no efficient treatment planning, or the model is there to give a recommendation of the dose delivery, still highly dependent on the manual process only as an estimate to detect the region of for the dosage. And they are all, the doctors are only depending on the manufacturer dependent machine based software. So that was actually, it was a painful things. We thought we will actually try to automate. So we are actually planning to develop a model which will identify the respiratory motion of the lung tumor for achieving the higher accuracy in radiotherapy treatment planning. Especially we will be concentrating on the radiotherapy. So that is actually to classify the lung tumor based upon the breathing patterns and the irregular variations in respiratory motions. So this is also used to actually, PET CT image fusion. So we will also try to develop a submodule for fusioning also, because when we actually, went through the literature, very few models are actually available for these kind of a fusioning, because the recent trend is people are trying to use a hybrid medical tools. There should be a generalized model which should be needed for actually doing the fusion for validation of the result. But we will be actually limited to PET and CT. We may try to extend our work with respect to MRI, fMRI, all those kind of PET MRI and CT MRI. All these combinations can be used in future. So then we thought we will try it out. But even though this objective is very difficult, but we thought we should actually achieve this. So till that fusioning, we have completed 3D virtual model for the better representation of the lung tumor. We thought we will be using the GAN to generate, the 3D model. The social impact of the work is actually one of the most commonly, occurring type of the cancer, which has been increasing rapidly. It is a huge loss for the family, any family matter. If someone in the family is going through such kind of form of cancer, early detection and proper treatment is really needed, considering not all the patient can afford for treatment for multiple sessions. So the proposed method, that is our method, will help in accurate radiotherapy, treatment planning and delivery with the right dosage of monitoring breathing patterns to track the respiratory tumor motions, which is a major cause of creating artifacts in diagnostic images. So by this breathing induced motion of lung tumor is a leading causes which affect the radiotherapy planning and treatment delivery. Such a respiratory movement in the tumor makes it difficult for the accuracy of treatment delivery, so that it can cause the serious damages of the healthy organs and tissues near the tumor if the treatment dose is not delivered in the appropriate region. So I thought I will give you a figurative representation also. So this respiratory movement, lung tumor, is the movement of the position tumor to respiration or the cardiac motions. The lymph nodes are the small bean-shaped structure, which is the part of the body immune system. They are present throughout the body, as we all know that. So when cancer has spread to lymph nodes, there is a high risk that the cancer might come back after surgery. So any cancer that has actually spread to lymph nodes can spread to other organs as well. So we have a figurative representation also. Just look into all kind of stages, the lung tumor with respect to the spread in lymph nodes. This one, the stage 1 is actually the lymph nodes is separate, tumor is separate. Over a period in the stage 2, when you see here the cancerous lymph nodes, the lymph nodes are also which is getting affected. You can see the purple dots are there. In another stage, it is actually spreading into the major portions. Like this, actually, we can categorize. See, as I already told you people, it will also affect into the other organs. See, because the lymph node is actually getting affected because it is actually going across the body. The last stage is actually stage 4. It is actually trying to represent other organs also, how this tumor is actually, getting traveled through this lymph node. That's what actually which was shown here. I have actually a YouTube also. If possible, I will try to show you a 1-minute video it is. So this is actually the representation. Just let us actually try to see how the respiratory movement is trying to, make a disturbance for the other organs. I hope this YouTube is actually, it is visible. Yeah.
Visible.
Is that visible, ma'am? Can I get some? Yes. So when you people see here, this respiratory things, which is actually a lot of disturbance will be there with respect to this particular things. So that was actually the difficult task for the doctors to make modifications or the accurate treatment planning. So with that, actually, the hybrid model, what we told is we will be limited to PET-CT fusion for lung tumor during the radiotherapy. This is actually a sample snapshot of the PET and CT fusioning. Other related works, I thought I will just brief about the works which has actually happened so far with respect to this particular field. The first author proposed a model to detect the intra and inter fractional variations of the lung tumor by tracking the motion in several fractions. The interfractional motion, which includes the breathing patterns as well as the external factors such as weight gain or loss or change of position of the patients. The time duration is longer and can go up to minutes and several sessions varying from day to day. The intrafractional motion is indicated by changes which occurs when the patient is actually undergoing a radiotherapy treatment, such as an internal organ motions, breathing, swallowing, and its time interval can occur within seconds or minutes. So the study aimed to enhance the tumor tracking techniques and also to reduce the commutation time. See, the overall accuracy, what they achieved is 80.37. The work was actually supported by the American Cancer Society and the National Science Foundation, used breathing pattern data for the study they used. And the second researcher proposed a markerless feature extraction method to detect the rotation of the lung tumor. This method is mostly targeted at image guidance radiotherapy during the delivery of the treatment dosage. The proposed automatic feature extraction method in their paper is able to match the landmarks in an image pair. So to evaluate the performance of the feature extraction method was applied on the region of interest around and the tibrum and the tumor, and comparing the estimated motions which obtained by the extraction of the tibrum profile and the segmentation of the tumor respectively. They used the MRA data set was used for the proposed work, and the result is actually relevant to rotations, showed that the maximum rotations up to 7.9 degree were quantified by the proposed approach. So the researcher also has explained, due to the increase in time interval and frequency, the monitoring of the lung tumor rotation becomes vital things. And the other author proposed a motion freeze technology which aimed to correct the PET acquisitions for respiratory motions, leading to superior image quality. So why this image quality is very, very important? The image quality of a PET is heavily dependent on the total number of count used to make the image. So the achievement of the true count rate is challenging, as it has to go through a lot of corrections before the actual image with better image quality is achieved. Motion freezed integrated is 100% of the PET count and compared with the CT image to eliminate the mismatch of the PET CT fusion image, which increase in the license size, reduction of measured standard uptake value, etc. So the author is also claimed that integrating 100% PET count has the potential to eliminate the influences induced by the respiratory motions in PET. That is very, very essential. So that is also we have taken into consideration in our work. So it is sometimes said that 10,000 CT make up to 95% counts, where the percentage of the true count are roughly 2%. So the author has also mentioned about the major limitations to the clinical adaptation of the respiratory motion corrections, or the need to use extra CT dose and the need for additional acquisition time. So the author has also claimed that there is a high potential to overcome such challenges by adaptation of 3D motion for the better accuracy. And the another researcher proposed a technique to predict the lung tumor during the respiration on the basis of external breathing signals. The neural network filters were used to correlate the tumor positions with respect to the external surrogate marker. These external surrogate markers are the biomarkers, while simultaneously predicting the motion again ahead in time for situations in which neither the breathing pattern nor the moving anatomical elements are constant in time. So one pancreatic cancer patient and two lung cancer patients with mid or upper lobe tumors were fluorescently imaged to observe tumor motions synchronously with the movement of the external chest markers during the free breathing. So the external marker and tumor movement was correlated to predict the tumor position up to 800 milliseconds in advances. So the predicted tumor position was compared to its observed position to establish the accuracy to track the tumor motions under non-stationary conditions. The researcher also claimed that if the tumor and the surrogate marker does not change in time, then the filter will not actually improve the result. The similarity is actually similarly, if the time interval is temporarily stationary, then the filter will predict with constant accuracy. By varying the time interval between tumor positions update, it was found that as the interval increased, the prediction accuracy is actually, it is diminished. So it is actually reversibly correlated with each other. The other researcher, Bin Low et al., proposed a deep profile model to individualize radiotherapy dose and to predict the radiotherapy treatment failure of lung tumor in varied clinical setting. Deep profile is actually a set of tools that allows to use a deep learning for analyzing imaging data, for extracting and observing individual information from microscopic image of cells. The model also had a radiomic feature incorporated in it. The proposed model consists of feature extraction from images, estimation of the handcrafted radiomic features, and a network for generating image signature for therapy outcome prediction. It also includes the field of medicine. Radiomix is the method to extract a large number of features from radiographic medical images. And CT images were used for the study. Comparison was done for the post-therapy image upon which statistical analysis was done, which was found that the cumulative index of 77% was the rate of treatment failure in varied clinical setting. The success rate of the treatment is lower for high-risk patient compared to the low-risk patient and the stage of cancer. This was actually funded by the Siemens Medical Solutions in USA. And the total summary from our literature is actually there are many papers we have listed out here. The category is different methods and tools for tumor motions, deep learning and CNN, which is the kind of a biomedical engineering related research work stating new technological use for better radiotherapy treatment. Then management of respiratory motion, gating system is there, a general overview of the different method, insight into tumor motion and its effect in treatment phase. And gating system also had an overview of medical approaches before and after technology, an explanation on residual motion and diagnostic imaging procedure. The taxonomy is actually lung cancer patients, oncologists. These two are actually the target audience. Medical methods are forced shallow breathing with abdominal compression, breath hold techniques. These are all actually medical methods. Respiratory gating techniques, radiomix, free breathing techniques. These are all clinical methods. Algorithms actually used from the literature, what we found is a fuzzy deep learning, gradient descendant, long LSTM, that is a long short term memory, neural networks, markers, CNN, linear adaptive filter. So, yes. Yeah, any doubt? I think somebody unmuted. Can you mute yourself? The research findings from the current work, that is the existing work, is traditional medical methods such as free breathing, breath hold technique have been studied for correcting the position of the lung tumor. The neural network model have been most frequently used model with minimal computational time, which can produce a good quality images and possess the capability to detect the respiratory induced motions. With that, we also actually extracted few limitations with respect to the current method. The diagnosis of the actual tumor position is actually detected manually, even though multiple methods are actually trying to detect the tumor and trying to get the accuracy. The oncologist is entirely depend on his or her expertise and assumptions for accurately planning the boundary region only. So no real-time model to assess the oncologist for an efficient treatment planning. That was our motivation to develop an automated AI-based model to predict the tumor size as well as to categorize the tumor in the lung with respect to the PET CT for giving the efficient treatment planning. Obviously, we cannot replace the doctors because we can only give actually a guidance, second opinion. Doctors can take the second opinion. So, because what I understood from world level congress when I attended, Dr. Devi Chetty, he is a Padma Shri. You all may be knowing him because he is one of the well-known, the heart surgery things. Every day he tried to complete 13 to 14 surgery as the average. Neighboring institute, from the Narayana Hridalaya, he is the managing director also. He also mentioned in his talk stating that actually in 2023, almost all the doctors will depend on intelligent systems or the smart software for taking the second opinion before they go for any kind of a treatment. So it is actually witnessed, and also it is the state of the art for us to think about different kind of cancers are there. And there are few cancers actually which is easily diagnosed, and there are few things like respiratory systems. It is really difficult to actually, for the patient as well as for the doctors to, get treated. So the deliverables, what we thought, the input consisting of a PET and CT image, various breathing patterns from the diagnostic machine. The research model will assess the oncologist to identify the lung cancer affected area accurately Deliverables include 3D model. We are trying to actually, generate a 3D model using again for the lung cancer affected regions, which can be viewed from multiple angles to assist the oncologist. And also the targeted process is to enable the oncologist to plan the treatment phase with accuracy in deciding the boundary region for dose delivery. Because I also had a personal experience with this kind of a cancer, because one of my friend, the father, is suffering with that for past 3 years. Actually, that person is undergoing a chemo, and he is already 75 years old. And for my friend, actually only one family member, because she is totally depending on her father, because she recently lost her mother with diabetics, then this COVID and all those things. So how much actually it is difficult for the family also to undergo, as a patient to undergo, even it is very difficult to swallow, very difficult to actually take even the food, that much actually lot of things are there. So and there are some task what we have actually done so far is pre-processing for lung tumors, image pre-processing. Why this image pre-processing is very, very essential, as you all know, the audience of the image process workshop, you all know that the quality of the image can be improvised with respect to the pre-processing. We can actually identify the unwanted things, which is considered the noise can be removed. So it is highly important, especially for the lung tumor, as a breathing, because when they try to breathe, it will introduce the motions, no, which will actually distort the image, which will actually create a lot of noise. The purpose of the image processing is to improve the image data, to eliminate any undesired distortions and enhance the image features for further processing. So now we used 3 different methods. Linear filter, as you all know, linear filter is one of the pre-processing techniques which has been experimented, and it is useful for correlation of the blurred image, including motion blur. The filter is essential for noise removal, especially when the concerned image characteristic consists of additive noise, which is added as an external, added noise. So this is an experimental, the sample, that is the regenerated image with respect to the vinyl filter. We also use the contrast enhancement. We know that the contrast enhancement is one of the popular techniques, which is also experimented to do the acquired images, does not have the desired object contrast. So the improvement of the contrast is needed as the organ shape, boundaries and internal functionalities, which can be depicted in a better way. The contrast can be increased or decreased as per the need. This is the representation from our experimental result with respect to the contrast enhancement. The result actually showed that the tumor region, see here, the tumor region is actually, which is clearly visible. Let me take the highlighter, the ink highlighter. So the try to see here, the tumor region is actually, which is highlighted, very visible than the original PET image, which was actually blurry and faded out. Okay, so here was the tumor was there, but it was not that much actually clear, but it is actually, it is very much, visible and more clear. And then another thing what we used, point transformation techniques, is you all know that a logarithmic operator is used for reducing the contrast of the brighter regions. The transformations occurs in the shape of a log. So S equal to C into log of 1 plus R indicates the image which is being processed. S is the output and C is the constant which can change the values. And then this is the representation with respect to the point transformation. The outcome of this experimental work actually suggest that the certain image, our observations actually made with respect to this point transformation, certain image with very high contrast due to the high uptake, levels tend to hide the tumor regions. When you see here, it hide the tumor regions. So which was actually highlighted, the artifacts were highlighted very nicely. So hence balancing and contrast can lead to better identification of the tumor. So whenever we feel any kind of an artifacts is hidden in this original image, if you wanted to highlight, so this is actually, maybe the a patient maybe lie down on the bed, that can be even bed or a pillow, or maybe external argument also might have been captured along with this images. Okay, that's what it is actually visible. We also worked with removing the artifacts also. We also used the histogram equalization. It is one of the popular techniques for in the image processing field for improving the contrast improvement. It is performed by stretching out the intensity range of the image. The experimental actually, which is used to identify further enhancement, contrast is required, and how does it perform for PET scanning is very, very sensitive imaging modality. So which will allow the areas of lower contrast to gain the higher contrast, and it can be beneficial for detection of a tumor region as tumors appear darker in the image. This is the representation. So it is actually, it is a histogram equalization is actually trying to highlight this tumor. And this is a representation of the noise. As you all know, when you try to use a histogram equalization is also one of the method which is used to identify how much it is actually the noise is occurred. So these are all actually the noise region, which is actually, highlighted in our graphical representation also. So this is the outlook on manual fusion, because as told, people are trying to, manually fusion the PET and CT image, but it is not that much clear. This the image is actually taken from the medical image reader and the viewer math work, and manual fusion of the PET CT image is also, it is actually represented here. This is also, we have taken it from the medical image reader and viewer. So if anybody is interested to go and see with respect to the fusioning, you can always follow this particular link for identifying that. Image segmentation. So then we actually worked segmentation as one of the pre-processing techniques. So at the time of the implementation of the image segmentation for lung tumor, the diagnostic image are divided into different segments, and most relevant images goes into the treatment planning phase as the final output. Unwanted features are removed in an image that can cause the faulty treatment, and it can prove the fatal. So then there are three methods which we found that from the the existing literature. One is a conventional neural network, that is the CNN method, watershed segmentation, and the Otso thresholding method. And I also actually highlighted the accuracy of that particular things. 1 second, let me take the arrow. Yeah. Yes, any doubt? Somebody had. Yeah. I request you people to mute yourself. So we observed that the performing segmentation technique, PET CT scan analysis, it's actually the highest performer, because CNN is 99%, watershed is actually 96, and Otso is actually 97. It again, we cannot generalize, as you all know, when we did actually the experimental study for our even the cardiac arrest, we found that CNN is considered as one of the efficient techniques. But when we applied for our MRI image, we understood that the CNN was not actually doing really well. But here, with respect to the PET and CT, based on the survey, what we found, it is CNN actually reaching 99.29. This is actually considered as one of the highest performer for doing the segmentation with respect to PET and CT scan. So watershed segmentation provides a complementary approach to the segmentation of the object. It is useful for the segmentation of the object which are touching one another. An image is considered as the topological surface, tries to find the distance from every pixel. The important point is actually using the watershed is to change the image into the another image whose catchment basins or the objects what we wanted to identify. We have actually experimental work also, we have done it. This is our representation with respect to the PET CT segmentation using watershed on the PET image. Look at, this is the original image. Nothing is actually, it is clear. When we did the background subtraction, that is image subtraction, little bit it is improvised. Then when we did the conversion into black and white, that is grayscale, it is actually the tumor was more clear. Then we did the distance transformation to find the non-zero values. So this was the output actually we found. Then we again actually did the segmentation using the watershed. So this is actually the final outcome for the watershed method for visualizing, because we used the color mapping for visualization. And Otso thresholding is one very good method The purpose of having an automatic thresholding is, which uses it helps the pixels of an image to make the image easier to analyze. So we all know that also thresholding will actually give a thresholding values where we can try to take that so that it is easier for to analyze. So the image is converted into a binary image, and that is a black and white. The primary use of the thresholding is to select the areas of interest and avoid the parts which are not actually concerned. It was very, very essential. So what we did is actually using the OTSO with respect to the PET scan, PET image. This is actually the outcome of the OTSO. This one is the original image. So this OTSO thresholding does not perform well on low contrast PET images and causes the complete loss of the details, because this whatever image we have, a blurred image, that was actually completely lost. So we found that the OTSO method is not suitable for the low contrast. In the experimental result, we also implemented the segmentation using OTSO for the CT image. But what we found is actually, you could see here, the CT scan performed better compared to the PET. Because when compared to the PET, the original thing is actually which is removed completely, the total loss which is there. But it is not with respect to the PET CT scan. CT scan, also thresholding segmentation is actually, it is performing better. It was able to preserve the details. However, it is not sufficient enough to detect the tumor. And then so tumor is actually so we have actually evaluated and kept. We are trying to build our own method for that. And since it is actually, we have not published the work, I am not actually disclosing the informations. And the image fusion, let us actually know why this we went into the medical image fusion is. It is actually very, very essential for synthesizing and registering image from two imaging modalities to acquire a fused image with the clinical information to improve clinical applicability and medical diagnosis. So the primary usage of the multimodalities for lung cancer diagnosis is to gain insight on the prognosis of the disease, attain the qualitative information, tumor staging, devise a treatment plan, and real-time intraoperative visualization and monitoring. Because one thing I have to tell, recently I involved with actually the development of multi-model with respect to the multimodality, because the recent trend in the medical field is handling heterogeneous data. Because it is not that doctors are actually trying to see only one kind of a medical images, because when the diagnosis become very difficult, it is always needed for them to move into the other one. It is better to actually combine more than one method, like a PET CT, MRI CT, PET and MRI, like that. So the success of the multimodality imaging is due to the possibility of maximizing the potential of the medical image, which reducing the limitations of each modality to attain the complementary clinical information. However, the several PET image artifacts are characterized by scan duration, patient-related motion, and the attenuation of the artifacts. So artifacts in medical images, we worked especially with respect to PET and CT. Several PET image artifacts are characterized scan duration, patient related to the motion, as well as the attenuation artifacts. At the same time, CT image have shortcomings due to the patient-based artifacts, physical-related artifacts. There are variety of artifacts are there. We listed out only few. Scanner artifacts. The mission also introduced the artifacts. I hope all of you know what is meant by artifacts. Artifacts are nothing but the external noise which is actually introduced during the scanning time. Okay. So what we found, the CT images have lot of actually, artifacts, patient-based artifacts, physics related artifacts, scanner artifacts, helical and multi-section techniques artifacts caused by image reconstruction processes, which diminishes the image quality and spatial resolution in the image. Therefore, the mere fusion of a medical image without appropriate image processing can hamper the diagnosis, as a critical information can be disrupted by various artifacts or noise. So we also went into read a few literature with respect to the nuclear medicine. We thought it is a part of the nuclear medicine also. we found a few expert in this particular area. As you all know, very difficult to collaborate with nuclear medicine people. So image quality plays a vital role in nuclear medicine. Nuclear medicine is the primary source of medical imaging, from where images are sent to oncologists for treatment planning. Reliable images for accurate diagnosis and the radiotherapy is possible with high quality images. Improved image quality is characterized by correcting the contrast, spatial resolution, and noise. So I'll repeat, because improved image quality is really, really essential. It is considered as one of the very, very important characteristic to correct the contrast, spatial resolution, as well as to remove the noise if possible totally. So image contrast varies as per the uptake value before diagnostic imaging and the patient activity. So now, what is the research findings from this particular existing workers? What we found is a spatial resolution is the ability of the imaging modality to reproduce the details of the radioactive distribution. So in some cases, contrast enhancement is helpful for organ delineation without removing the background activity. The organ of interest can be outlined efficiently using the contrast enhancement techniques. That's what we understood from our experimental work. Research findings from implementing the PET CT, that is especially training the PET CT data, traditional medical methods such as free breathing. I also introduced what are all the traditional methods are there. I'm just referring again to the traditional methods like free breathing. Breath hold techniques have been studied for correcting the position of the lung tumor, because I always remember that with respect to the the tumor in the lung tumor. And see, I am actually I am a throat infection patient, as you all know that most of the singers and the teachers will get infected very often. So my vocal cord will get always infected. I had even a doubt whether something is wrong, because when I go to normal ENT, people try to give actually antibiotics for the treatment. But then what I found it is the acidity, because I had an abdomen acidity, which is actually when we sit, it is actually pressure is there. It will come up and then it will go into the, it will create an acute acidity. And the acidity is actually in the form of a swelling will be there with respect to the vocal, because when we have a throat infection, generally we teachers unknowingly we may try to, stress ourselves and, talk from the abdomen. So in that particular cases, I troubled my vocal cord like anything. Then the vocal cord will get swelling also. So then I went and met one Dr. Dinesh from ENT hospital. He is a surgeon from Germany. So he always used to do endoscopy. Even I could not tolerate of getting the endoscopy as a patient, because it is very, very difficult, to swallow the even the saliva also, because they put the numbness in the throat and they put that machine inside and they try to find out what is there inside the vocal cord. So then he found that it was a swelling was there, infection was there with respect to the vocal cord. Okay, so because then I understood that, then from that time onwards for past 10 years, if anything happened, I will go to him. I also go to pulmonologist, because I have a allergic problem. Recently I heard there is actually a skin prick test that is actually useful for the allergic test. Why I'm telling is, these are all the things, even it is not actually reachable to the common people like that. They call it as an SPT. What they do is skin prick testers. Actually, first they will try to take our blood samples and check with all the food items, whatever they are trying to have. Being a vegetarians, it is very, very complex for them to check which food is actually it is allergy. Then they found with that particular blood testing took more than a week. Then what they did is actually based on that particular diagnosis, they went into the another diagnosis just to check whether what kind of actually the allergy is there for me. Why I am getting actually wheezing problem very often, because I am a allergy patient. I get breathing issues, other related things will be there always. that is also one of the motivation, because whenever I go to my pulmonologist, he's a PG surgeon, he will be always with his student. I also actually interacted with him. These are all the difficulties, what is that he told. So why I am telling all these things are actually, even the technology is actually, it is increased so much, but still country like us, the infrastructure we need to actually build, because we need to get the support from the government as well as from all over the world. So now these kind of traditional methods, it's not at all possible even to find out what kind of a throat infection it is. That's what I wanted to say. Lot of difficulties I underwent when I did the endoscopy. So you just think how it is actually to take a PET and CT scan with respect to the respiratory, because both the respiratory organs are there. Heart will also induce some artifacts. These two are neighbors, okay, which will disturb each other. So that's what a lot of challenges for the radiologist actually. So approximately 1 centimeter of tumor movement is observed due to the respiration. It can be more for patient in advanced stage. So the current medical imaging software, which is try to lack in the automation of the image enhancement techniques. In case of a low dosage, the boundaries appear mildly. So therefore, the improvement in the sharpness of the edges of the tumor is crucial, as the edges appear blurred. So I hope I have a time. I think I have 30 minutes time period is there. So we also did some experimental work. So there are few learnings from our experiment with respect to the PET CT. As I told, our work is actually limited to the PET and CT. So when we did the training stage, high contrast image because of high dosage, hence there is a lack of actually clarity of the tumor, as breathing causes the blurry edges of the tumor. Therefore, smaller sized tumors don't appear in the image, because when it is smaller, it is actually very difficult to identify and diagnose. And in the contrast enhancement in the images, as both modalities produce a different image quality. So image pre-processing is a very important factor to be considered, as the breathing causes several problems with respect to the direction of the tumor. So we did actually the lung tumor motions. I had shown that already. So this is the motions, how it is actually getting disturbed with respect to our diagnosis. Then why did you perform? Because there are many people asked when we actually discussed our work. Perform the pre-processing on PET and CT images separately, because PET and CT fusioning we were doing. Why we did? Because PET is one kind of a image, CT is another kind of a tools. In nuclear medicine, PET and CT images are always processed separately, and the final outputs after image processing is fused for better diagnostic. So that is the reason actually we did pre-processing separately with respect to the PET and separately with respect to the CT, because this is the learning from the nuclear medicine. In addition to that, a specific image processing filtering techniques may not produce the same output for both modalities due to the presence of variable noise and different image quality. Variable noise means one can be a physical noise, another one can be actually the other kind of external noise. So different kind of an artifacts will be there, which will be very, very difficult to identify. So that will actually affect the image quality. So that is the reason actually the pre-processing is performed separately. We are also trying to try to show that why I am saying we means, it was the most of the thing is actually implemented with my scholar. I only directed him to do how it should be implemented. So linear filter worked well. We actually from the literature for PET images, whereas in CT images there was no variations in the quality. So as PET image appear blurry with a lack of resolution, linear filter performed well in restoring the blurry image. So this is actually the reinitiated image, which is actually highlighted here. Separate pre-processing result also, which is shown here. This is the original CT. Previously, it was the PET, and this is for the CT. So you could see the artifacts is now how it is actually reinitiated, highlighted. So how will you identify the image quality of the pre-processing? So suppose this is a research question. No, why this method is actually used? is this image is actually a quality image after the pre-processing, that is actually a 100 questions will be there. It is actually always doubt whether whatever pre-processing we are using, because we cannot see from the medical point of view. Always we should actually consult the doctors to cross verify whatever result we are trying to get it. So we also actually cross verified with pulmonologist as well as with the nuclear medicine expert, as medical images such as a CT image requires several slices. Therefore, image fusion may lead multiple images to provide a detailed view for prognosis of the disease. To store and process multiple images requires compression for cost-effective storage, because image compression must be performed without losing essential diagnostic details in the image. We all of us know handling the image is very complex. If you are not compressing, also problem. If we compress also, sometimes we may lose the original image, but without actually compromising the quality of the particular image, we need to do the image compression technique. So to identify the image quality, we applied PSNR and SSIM is implemented to identify the image quality, and it is effectiveness in preserving the crucial details are actually presented. The problem in pre-processing stage, what we actually experienced is during the image acquisition and processing of the images produce the diagnostic devices, the original fusion techniques suffer from additional noises. Thus, the diagnosis suffer from such images. So, several originality fused images are not consistent in the data set by the manual fusion. The presence of pre-added noise occurs due to the problem of PET images appearing in white background, whereas CT images have a black background. You might have noticed. Otherwise, I will show you people. This is the CT image, which is there in the black background. PET image, which is there in the white background. So, the characteristic itself, it is two different characteristics are there. So, even the quality measurement also we need to actually do differently. So originality actually it differs with respect to the PET and the CT, where although the noise removal helps in improving the image quality, there are a lot of artifacts which can introduce unwanted features into the image, which can lead to the misinterpretation of the image fusion and the misdiagnosis. And this is actually some of our experimental work. I am just showing it to you people. Considering the time duration, because it is only 1.5 hour time it is given, image noise and artifacts infused images. So when we did in the gray background noise, artifacts leading to misrepresentation, because when you see here, this is one artifact and the other artifacts also which is there, which may actually interpret and look like actually the tumor kind of a thing. So the ring artifacts, these are all actually some of the artifacts. This is actually the ring artifacts in CT image. As you know, CT is a black background. Misinterpretation infused image due to ring artifacts. So when we try to do that, we may try to do the misinterpretation with respect to the ring artifact. There are several artifacts we identified. We worked with frequently, used or maybe frequently occurred artifacts with respect to the CT and PET. We are also planning to work with respect to the patent or the technology with respect to the fusioning technology. What is the challenges are there when we try to implement this algorithm? For the challenges is wavelet transformation is actually considered as one of the popular techniques we all of us know. So wavelet transform ensures the good amount of frequency resolution for low frequency components, especially average intensity values in an image or smooth regions, and high temporal resolution for high frequency components, which are the edges in the image. High pass filters highlight the high spatial frequency components, small objects and edges in the image, and is useful for image sharpening. So high pass filter is more suitable method when finer details have to be preserved. Low pass filter allows to have an approximate value, and it is highly useful for smoothing the image. Low pass filter are also typically applied to images with low spatial resolution, because it does not degrade the features, and also it is more suitable for nuclear medicine scans such as PET images. So the approximate image, diagonal details, vertical details and horizontal details are achieved by using the combination of low pass and high pass filters on the columns. Vertical, horizontal, and diagonal details in medical diagnosis. So the horizontal details in diagnosis relates to the axial information acquired from head to toe. Vertical details are similar to the coronal details, which provides the front and back information. Diagonal details are the sagittal information, which relates to the information from a sideways viewing angle. And this is the architecture, existing architecture, what we have taken it from the wavelet transform architecture. Low pass filter on rows, original image, high pass filter on rows, low pass filter on the columns, horizontal approximations, and then high pass filter on columns and low pass filter on columns is there. Approximations on image, low level, and the low vertical details, horizontal details. So this is the architecture what we used actually with respect to the wavelet transformations architecture. Image fusioning using the wavelet transformation. So we just applied the WT for the image fusioning with respect to PET image. As you all know, PET image is actually, it is depending on the white background. So it is blurred, it is not at all clear. This is a CT image. This is a fused image. It is a combination of PET and CT with respect to the WT. This is the fused image. Did you all understood? Because in the nuclear medicine, PET and the CT are the most frequently used images. That's why we thought we should go for these two kind of a combination hybrid approach. So in medical, PET is actually this separately and CT separately. After the pre-processing, we fused with respect to the WT. So wavelet transformation is used to actually do the fusioning method with respect to these two things. This is the sample one. After the fusioning, image subtraction. As you all know, image subtraction is one important process in the image processing, which allows to correct the illumination variation by using a reference image. So image subtraction is performed for two reasons. One is actually which will level uneven areas of an image and to detect changes between two images. However, subtracting the variation from one captured image to the other can result in different pixel values, even in smaller regions. For black regions, it was found to perform well without any variations in the pixels. But in the white region, as you all know, it was very difficult to do that. So performance after the image subtraction is, this is actually the fused image. So we did the image subtraction with respect to the fused image, because what fusioning we did, we combined the PET and the CT after the pre-processing. Okay, so then what kind of a noise in image fusion? Because fusion also will introduce noise. So then image subtraction for improved background, because gray color image is actually turned into dark background. So you see it, which is the tumor is which is getting highlighted. Even the artifacts are, this artifacts we could not remove because it is not disturbing the lungs. That's why actually we are keeping it. Not that all the artifacts it is necessary to remove it. So after applying the image subtraction, the background is actually, it is improved into the dark background. So edge preserving local contrast. Edge preserving local contrast is one filter method, which is a very popular method, which will allow us to enhance the local contrast, the image, by smoothing details of the image without affecting the strong edges with the help of a threshold values. That's what actually it is highlighted here when we applied local contrast for preserving the edges. Okay, so can you just see here, the edges are actually, it is preserved. This is the original image. We applied the local contrast, then we got all these actually the edges. Okay, to preserve the edges, we used this. And peak signal to noise ratio, I told you people PSNR and SSNR is used. For medical images, there are several distortions which can occur during the image generation. Optical lenses and sensor which can lead to loss of quality. So when the original data is compressed, like when you try to make a fusion with respect to CT and PET, so when with respect to the compression, which introduce an error, which is the noise. Okay, so PSNR is actually which is used to measure the quality of the reconstructed image. So we used as the noise removal method. A higher PSNR value indicate the high quality of the image reconstruction with improved perceptual quality. The PSNR value within the range of 30 decibel to 60 decibel is considered to be ideal to investigate the performance. Okay, and we also actually use the structured similarity index. The structured similarity index is used to measure the similarity between two images, including the luminance, contrast, and image quality during the data compression or data transmissions. So this measurement of the image quality is based on the initial uncompressed image, which is distortion free, which is used as the reference for the doctors. So a structural similarity index allows to identify any changes in the structural information, which is helpful for medical images. The overall index is the multiplicative combination of luminance, contrast, and the structural information in the image. So the experimental work, we have actually just listed out few samples here. This is a CT image, images from left to right. This original PET image is there, as you all know. White background is the PET image and the dark background is the CT image. So these two things are, the first one is the PET and the second one is the CT, originally fused image. So these two combined, this is the fused image, and the fusion is implementation of the self. So the highlighters are there. You could see the more clarity is there with respect to the third image to the fourth image. Okay, fusion implementation with respect to the self itself. So this is actually the SNR original image value, the visualization, noise visualization, which is represented with respect to the structural similarity, also which is represented. The other experiment, PET image, again CT image, fused image with respect to other samples. Then we have actually highlighted the visualization of the graph. And then this is actually just I am showing 3 samples, okay? Because it is we are working currently with the 50 images because it was very difficult to collect the PET and CT with respect to the same kind of a patient. And then the scholar is from the medical field and his parents also from the medical field doctors. So with their reference, I should acknowledge Kaushik parent gave the references, and he is also a software consultant for the medical software. So we have actually taken 50 images currently working with that, and we may try to extend it for 150 image because our concentration is with respect to fusioning. After fusioning, we will try to remove, identify the quality of the particular data and remove the noise. Again, then we will go for the segmentation, and then we will go for actually the stage classification. So this is the third image, PET CT and the originally fused image with our experiment. This one is actually the CT and the PET. This is the fused image grayscale, and when you apply the color mapping, as you all know, when we try to apply materialization, because when we do coloring will actually try to give a better clarity. So that is actually a proven example here, and this is a representation of the PSNR original experiment. Structural similarity. So what is the actually the distribution of pixel intensity using the WOTSO for PET images? These are all the noise ratio which is highlighted here. So so that's all from my end. Actually, I think I have time because it is 1.5 hour period. It is there. I have not stopped in between. I thought I will actually give a break, then continue. I also have one more work related with the lungs. If you people allow, I will explain to you people. Okay. So thank you, and I will give you a 2 minutes break for the question. Then I will continue with one more work with respect to the lung tumor, what we actually presented in the Prism, and we got the award. Any questions or any? I think I have a time, right, ma'am?
Yes, you have time, ma'am. 20 more minutes.
Yes.
We can give them floor to our participants. Those who are having any clarifications, please ask your doubts.
Yeah, any questions I would like to, take it. Otherwise, I will be, sharing one more experiences with respect to the lung itself. I thought I removed actually recently because considering the time factor, but then, yeah, hope it was actually, understood. Whatever method was very popular, we could actually present. But then the proposed work, we were not actually, showing it here due to the, time constraints and other issues are there. Any doubt, any clarification is required, we will stop it for 2-3 minutes, then I will continue.
Madam, we have a few questions.
Yes, sir.
The last slide you were mentioning about the coloring actually. So we have a monochrome images. So what was the coloring technique you used to convert it into color images, ma'am?
One second, sir. What is your question, sir? What are the coloring techniques
Yes,
used?
yes, ma'am. Or how do we actually map? We have a monochrome, so we have a pixels ranging from 0 to 255. So that needs to be mapped to the RGB or something else. So how do we do that mapping, and what was the technique being used?
There are several techniques available for coloring, as you know that, no, sir. The popular things, yeah. So what we did is actually we try to actually, simply use the color map for doing the coloring.
Okay, ma'am. So in that case, so do you specify something? Say, for example, if there's a tumor or something, so do you use any other color to mention that it is? Mention it in a different color.
That means, see, in my experience, I will tell you, sir. Actually, materialization is the one you might have heard about now, sir. Coloring for external materialization, it is nothing but when you try to introduce red color, or maybe yellow color, or maybe like a tiles color as the background. So the image clarity will be visible, visualized. Right, sir? So what we used is actually we just use the color map techniques. We introduce the brighter color to highlight that. It's simple coloring techniques we used.
Okay, when the reason I'm asking is like because once after we're done with the fusioning,
Okay,
the coloring, so we'll be moving on for the diagnosis moment. So for the diagnosis, the experts or the radiologists can use this fusion technique. I mean, fused images. So how do they actually identify whether it's a malignant or a benign? Maybe based on the color or something.
no, sir, not based on the color. Color is not the one of the features for identifying which stage it is. I understood your question, sir. Yeah, thank you, sir. Because I hope you're also going for a fusioning.
No, ma'am, no, not it.
Yeah, tumor is actually based on the volume it is measured. We can categorize with respect to the volume of the tumor. Depending on that, stage 1, stage 2, stage 3. I don't think so, because it will vary also from one kind of a tumor to the another kind of a tumor. Because we cannot actually generalize that darker the image, more severe stage, or lighter the image, less stage. It is depending on the size of the tumor. Yeah, I could see Kaushik is there. Yes, yeah. Kaushik, would you like to answer more? I hope, Balamurugan sir, I clarified your doubt.
Yes, ma'am. Yes, I got it.
Thank you so much.
If it is okay, can you please tell me about what are the different tools and packages you used for lessening?
Sir, please send a mail. We will try to share it with you. We are currently using the MATLAB, okay? And since I am also teaching Python, Python is also actually it is useful because n number of packages are there for you. So image processing, because it is considered as a very important things and very old technique. We will get lot of references with respect to MATLAB, but equally nowadays, even in the open source, the problem with the MATLAB is actually, we should go for a licensed version, but you can also use OpenCV in the Python, sir.
Yes, because I worked on this wavelet transformer. But
okay, sir.
I tried with both MATLAB as well as in Python. So Python, I find it a little difficult actually.
because you will not get the help. We will get a lot of references with respect to the MATLAB.
MATLAB, yes, ma'am. So MATLAB it was good. So that's
yeah, especially for image processing, MATLAB is the good one. That's what I feel with our experience, because we worked with the sudden cardiac arrest. That is also an MRI image, and we categorized actually the things, because it was actually the arrhythmia patient or not. If we delay the treatment for the heart attack patient, arrhythmia will occur. So depending on the size of that particular things, whether ICD is needed or not, pacemaker is needed or not, that was the prediction actually based on that particular work. So there again, actually we used only MATLAB. So we felt that image processing currently, even though Python is actually, it is equally giving a lot of facility, we used only the image MATLAB, sir.
Okay. Ma'am, you were mentioning about that measuring and the direction of the tumor, ma'am. So
Yes,
how
sir.
do we actually measure it, ma'am? So measuring is, do we use any?
You can use a logarithmic transformation, point transformation,
Okay.
and the orientation also can be considered, sir.
Okay.
Because especially this is with respect to the respiratory organs, very, very difficult to measure, because it is a movement, the organs are there. So it will vary from one place to the another place, and the artifacts also will look like actually the tumor kind of things. So which leads to a lot of misdiagnosis. As you know, when we actually combined two different images, PET and CT, also introduced some external noise.
Yeah, that's my question, ma'am, actually. So how do we actually differentiate whether it's an artifact or, I mean, like you were mentioning about the ring artifact and other kind of artifacts?
Yes, sir.
So the artifacts also can be, I mean, we can also find an artifact on the lesion also.
Yes, sir. Yes, sir. See, there are there are more than 30 artifacts are there, sir, actually. To name a few, what we have actually taken is frequently, used or found artifacts in the images that we have done, because I have found special papers in artifacts itself, from the medical point of view as well as from the IT point of view. So our work is actually not from the clinical perspective. So one doctor had written from the clinical perspective multiple artifacts and how it is getting disturbed. So identifying which kind of an artifact, is it a physical artifact, is it a movement artifact, it is a ring artifact, is it a bed? No, the bed, if they actually pillow also will give. So like that, it is, there are different kind of an artifacts are there, but there is no common model which will identify and classify this artifacts. We are actually working on that, sir.
Okay. One last question. So you were mentioning about the 3D modeling, ma'am.
Yes, sir. Yes, sir.
But I didn't mention in
no 3D model. Actually, I told you, no, sir. That was our final work. We could not complete. Yeah, we were into visioning actually right now. Our idea is actually that is, if possible, we thought of actually going for a 3D visualization, because to rotate and see how it is tumor is actually spread across the lung portions. But using GAN, we thought we will go, but no idea about what method it is actually we will be using it, sir.
Okay, ma'am. Okay. So I just wanted to know whether, I mean, if that work was completed, I just wanted to know what was the technique being used for.
No, sir, that is one of our objective. We may try to reach that. Okay. But as of now, yeah.
For using AR, VR, like.
Yes, exactly, sir. We thought of actually going for AR, VR into that.
Okay.
We have to actually cover the literature.
Okay, since I don't have practical knowledge on the AR and VR implementation, that's the reason I was asking. So just wanted to know any techniques relevantly used. That's the reason.
As of now, because I am also a learner in that AR, VR, sir. Because from the conferences we could listen, there are few methods are there, but yet to actually get which are all the methods are actually very, very popular. As you know, not easy to actually integrate with multiple disciplines, right, sir?
Yes,
so we thought of going for actually the augmented reality methods, but we need to find out the methodology which is efficient for getting the 3D, but we felt we can use a GAN.
Yes, ma'am. Okay, thank you so much.
Thank you, sir. Thank you for your valuable question. I think there is one more. Ma'am, if possible, tell about side effects which are associated with these diagnostic method. Dr. Anjani, ma'am, thank you, madam. As you all know, radiotherapy itself, which what I heard, because I'm not the medical person to say these kind of a side effect, which will give lot of actually, disturbance. And every time, what I understood is actually the immunity system is, which will actually, get affected with respect to these kind of diagnostic, and the entire body also, the lifetime of that particular people. Because when they try to go for any kind of a diagnosis, whether it is a PET or a CT or maybe for an MRI, they may spend 2 hours or 3 hours, and it will be actually the human body is inserted into the machines, and we try to undergo lot many things. It is actually really a challenge only. And what do I say, from the patient perspective, lot of difficulties are there. That is one of the disadvantage. There is no simple machine which can actually take PET and CT. I still remembered, just for the normal checkup, I went into the CT scan. It is very, very difficult for the ladies, especially to take that particular things, and get into the CT. We have to actually really think, is there any possibility to go for a simple machine? That itself actually one of the area in which where we can try to propose a low cost MRI machine, and low cost PET and CT, because so that it will be affordable to all kind of a common public. Or any, maybe technology may come after 5 years or 10 years, one machine which can take a PET as well as the CT. Because I still remembered, with respect to pulmonary test, even though the technicians say, as a patient I had experienced, ma'am, you blow it, and then when I try to blow, really, we need to experience, because it is very, very tough to, then again and again they will take it 2 to 3 times. So think about the chemo and all these kind of a diagnostic, because every time 3 months once or 2 months once, depending on the severity, they go and try to take these kind of a diagnostic. Lot of actually side effect. There are a few things we all know that there are multiple side effects are there. Medically to say, doctors may clarify what are all the side effects are there, but no other way, because we have to undergo that diagnostic method to go for a treatment, even though it which has the side effect. Can Python be library tool can be used for image processing? Yes, madam. Python can be used for image processing, Sudha ma'am. So these are all actually, because what I told is image processing, we will get lot of support, help, sample code from the MATLAB. Similar like that, we can try to work. But Python is also equally supportive, because the open source community and everything is a drag and drop, and use that particular Skykit library and other things where we can try to develop. But then certain things it is not actually developed and built like a MATLAB, because MATLAB is there in the industry for more than 2 decades. But then Python recently, it is evolving like anything. So any difficult diagnostic, I may say that, better to go for a MATLAB rather than going for a Python.
Ma'am?
Yes, madam.
Ma'am, how to create the motions, ma'am? Motion image. You put the slide motion creation of lung cancer, no, ma'am? How to create it?
Yeah.
If you any tools for that, ma'am?
We were not actually involved in the motion creation, because we just worked only with the PET and CT. Creation of the image, I think sequence of image, we need to capture it with the different time interval. Then artificially, we need to create the motions. I don't think so that is actually which is there, because that will give a lot of misdiagnosis or a lot of actually the artifacts, external noises. I don't think so that motion will be created. Motion will be captured with respect to the machine.
Okay. Ma'am, which scan is best, ma'am? Either PET or CT, MRI. Which scan is best, ma'am?
It depending on again the disease and the severity, ma'am. So we may say that MRI. So MRI is actually, it is very costly. As an average, 3,500 or 5,000 we need to actually put for things, and it may take more than 2 to 3 hours. Not that all the hospitals will have MRI, scanning machine, and it is easily, reachable as a CT only, I can say. CT has its own disadvantage and the advantage. PET also has advantages and the disadvantages. That's why now doctors are actually trying to use a PET and CT and MRI, like that, the hybrid method. So no one particular method is actually, it is very good or best among all, we cannot say, because especially with respect to the nuclear imaging, since I started with nuclear image analysis, brain imaging, fMRI, MRI, and EEG, ECG, EMG, etc. is there. But why these kind of so many multiple images are there? Because each one has its own advantage and the disadvantage. But we cannot say that MRI is good, fMRI is good. Again, how we are actually trying to evaluate? We can evaluate with respect to the accuracy, how accurately which will give the result. We can also evaluate with respect to affordability, how far it is. Country like us, most of the living populations are average middle class, not even upper middle class family. Is it affordable to take MRI image for the normal family? Because 3,500 or 5,000 may be a monthly salary or average salary for a daily wages people. So when we ask the people to take such kind of a diagnostic things, even to take a scanning, they may think twice. Should I go for taking MRI? Because I still remembered for our the domestic servant, we have actually spent around 5,000, but then the entire day which was gone, and more than 30 kilometers she traveled, and then just for doubt clarification whether she has any symptoms with respect to the heart block or not, we spend on the whole day. So the time factor and how long it is taking to capture that particular things, cost and the infrastructure, all those things are actually, it is a matter, madam. I hope you will agree.
Yes, ma'am. Last question, ma'am.
Yes, ma'am.
Ma'am, one person affected cancer in 90% means how we can measure this, ma'am, in computer field? Doctor knows if he are affected in 90%. We are in computer students, no, ma'am. How we can measure, like, ma'am?
It is, yes, yeah, very nice question, Bhavani madam, because I appreciate your question. All, it is a valuable question. We cannot actually, measure the severity of the tumor. We can only give a suggestions or recommendation through our algorithms, and the computational models are there. We try to actually measure with respect to MRI, or maybe with respect to CT, or maybe with respect to PET, how much it is affected, where and all it is affected. We have seen that if it is going into the lymph nodes, so because the lymph nodes are found in the human body, so if it is actually getting affected, then even after the treatment, after the chemo or after the operation, if the tumor is getting things, then there is a chance of getting again. Because what I found is, one of my close friend father is affected with, we cannot say that is a respiratory or the below that throat and below the brain. That's what they were telling it. Yesterday I had a discussion. 2 days before she went into that and did a PET CT, and then it is found that in another place also. And then her colleague son is actually 13 years old son is affected with tumor, but then that is went into the lymph nodes. But what I found is, it was a learning for me yesterday in the dialogue. RH factors, actually someone has to donate the RH factor, then that can be improvised, but again and again they have to go for the treatment. Because why I say that, if someone is actually suffering with the tumor, the entire family will be going into the very bad situation, because the family is gone, because the lot of money need to be spent for recovering or curing, but there is no permanent cure. We can only postpone their death date. If they say that 2 years, maybe we can actually postpone into 5 years or 6 years or 7 years. That level, actually we can do that. But we as an IT professional, we cannot actually measure and say that you are in this particular stage, the whatever model, whatever algorithms we are trying to automate, all those things are actually an assistant kind of things for the doctors to actually take a second opinion. So it is for the doctors to take a second opinion, which kind of a treatment they have to undergo. Will they recommend or not? Because I was talking about my ENT. He tried to recommend the people, connecting the old patient family members and say that this is very severe stage. So don't go for a treatment, because that person was an auto driver and his wife is a housemaid, domestic servant. And 2 kids were actually studying an undergraduate and postgraduate. No, so he was the breadwinner of the family. 3 lakhs was there actually for them to, go for a treatment. Even for 3 lakhs, it was very, very difficult, because I was sitting next to my friend. He was calling that particular patient and asking my friend to, recommend not to go for that. Let it be the treatment or medicine, he can take it, because the doctor feels that he is there in the advanced stage. No treatment can give a permanent cure. Even after 3 lakhs of spending money, maybe he may live for 1 year or 2 years, but not more than that. But the amount what they are going to spend for that particular treatment, it is not affordable. It is not at all possible for them to, to go into that, because multiple people have to work. So these are actually some of the problems in our society, especially with respect to the region where we belongs to, because our medical system is not integrated with the government. I hope I cleared, ma'am.
Yes, ma'am. Ma'am, one more question, ma'am. Ma'am,
Yes,
if
madam.
the cancer cell is divided in multiple cell day by day, ma'am. In starting point, we can block the cell, no, ma'am. It's possible to block the starting stage, ma'am. I think one cell
It
is
is,
divided in multiple.
if we can find the early stage, I think we can actually try to prevent, because I heard that one of my husband colleague recently passed away with the cancer. His sister is still alive, and he told it is by heredity also people get cancer. His mother was affected with the cancer. After the treatment, she lived more than 20 years. And when we went to see him, his sister was there, affected patient, but completely recovered. Then she was there because what he was telling is 20 years before she got operated, now she's so, you people don't worry. He was trying to convince us, don't worry, nothing will happen to me, because it is the heredity. But recently, for past 1 year, he passed away. But so it is depending on the immunity system and the individual body also we need to take, because he got, it is a stomach cancer. He got infected in the stomach. Then again, it went into the critical stage, and he lost his life. So it depends on the person to person, depends on which kind of a cancer to which kind of a cancer, whether we are trying to predict it in the early stage or maybe in the end stage or middle stage. That is also, it is a matter. And how far we are actually aware of this particular cancer. That is also, because we may not actually think that this is a cancer. We may actually go into the advanced stage or the middle stage to get the diagnosis. Then that becomes actually really a problematic one.
Okay, ma'am. Thank you, ma'am.
Thank you, Bhavani madam, for nice
Thank you,
questions, because all your questions are valid questions. A lot of challenges are there, still solutions it is required. So people like us, researcher, we need to spend more time and collaborate with medical doctors, even though it is very difficult to get their time. Somehow we have to actually get through networking. We need to actually collaborate and do a collaborative research and develop a automated system for right diagnosis for the right people for the right treatment. That's what I feel. So thank you, madam. Thank you for being a wonderful audience for all of you. I thought I should explain one more things, the tumor. It's fine. When I am meeting you people for next time, I am sure that Chitra madam will give again chance to interact with nice people like you people. So thank you all. Thank you for the Department of Computer Science, University of Madras, for giving me the opportunity to share our experience with respect, especially with respect to the respiratory related kind of lung tumors. with respect to the AI. We have not completed. We have completed only the 70% of the work. As Bala Murugan sir asked, we may be working with the 3D visualization. That was our objective. But it may take more than a year because a lot of difficulties are there bringing AR, VR into the work.
Good job, actually.
Thank you all. So that's it from my end. Any other question? Over
Madam,
to Chitra, ma'am.
Madam, one last question actually before we
Yes,
take
sir.
this respiratory motion. So we capture it as an image, no, ma'am. So
Yes,
we can also capture it as a signal, right, no, ma'am. So that's what I understood actually. So we can. Is
Yes,
there
sir.
any other way or any other mode which we can capture this motion, ma'am, apart from image?
Sir, there are a lot of medical tools are there.
Okay. So can we?
Yeah.
My question is, can we capture it as a signals, ma'am? Like we have a ECG, EEG. Like, can we
Yes.
capture it as a signal also?
It is there, sir. It is there. But we have not actually explored with the EEG or ECG
Signaling.
or EMG.
Okay.
Yes, it is there. It is there.
Okay.
I also know that, but it is there, but we have not taken that.
Okay. Okay. Thank you.
But that is not very effective, sir. That's what we understood from our literature. That is the reason.
Okay. Okay, ma'am. Okay. Understood, ma'am. Thank you.
Thank you very much, madam, for your valuable time and very informative and actually you have shared your complete research, and this will definitely help all the research scholars how image processing research with respect to the domain. You have been given step by step clearly, just like presentation in the conference. It's excellent, awesome, and also you have given some tips for them, and you have made it as an interactive session. Thank you so much. Followed by Akshaya will proceed with vote of thanks.
Yes, ma'am. Thank you, Chandra, ma'am. Thank you for sharing your precious thoughts. So, good evening to all. No duty is more urgent than that of giving thanks. It gives me an immense pleasure to deliver the vote of thanks for this event to all the dignitaries present here. I would like to thank our chief guest, Dr. J. Chandra, madam, who honored this function with the inspirational thoughts. Thank you, madam. I would like to thank our beloved professor, Dr. P.L. Chitra, madam, to organize this event, and thanks to other organizers, other staff members, students, research scholars, participants, volunteers, and last but not least, our beloved audience for making this function as a grand success. Once again, I thank one and all present here. Thank you. A good event never ends in the world. They take only the past and keep us waiting for the next. Let us meet tomorrow for an effective day 4 session on computational modeling of cancer genomics data for targeted therapeutics by Dr. G. Kumaresan sir, Professor, Department of Genetics, Madurai Kamaraj University. See you all tomorrow. Thank you. Thank you all, madam.
Thank you all. Thanks again, Chitra ma'am, for the opportunity. So nice to be here. Yeah, thank you.
Yeah, thank you very much. We will meet soon, and I think I will give you the forum in which you can share your next work. Actually, you have tried to do that, but because of the time limit, it could not be possible.
Yes, ma'am. Yeah, no problem, because a lot of interactive questions were there, lot of learnings even for me. Thank you so much.
Thank you.
Thank you all.
So much. Let us meet soon in our next forum, ma'am.
Yes, ma'am.
Thank you so much for your valuable time.
Thank you, ma'am. Thank you all. Have a good day.